My name is Megan Brown and I'm a nurse practitioner student at Auburn University. Today I will be doing my head-to-toe assessment on my patient Zach. For the purpose of this film, he will remain fully clothed just to protect his privacy. So when he first walked in the room, I would notice his grooming, his hygiene, his speech, to make sure it wasn't slurring, his mood. We will be assessing his skin throughout the entire video. We'll be comparing it, the vascularity, any redness, any obvious skin lesions from one side of the body to the next. So can you tell me your name and date of birth?
Zach, 7/15/1991.
What year is it?
2020.
Who's the president?
Trump.
And where are you?
My house.
Okay. We'd also be noting, we'll be just comparing, we're doing the assessment on one side of the body for the sake of this video, not doing on both, but normally we'd be doing on both sides of the body. So you go ahead and start by looking at his face, making sure, looking at the asymmetry of his facial features. You want to be looking at the shape and contour of his head. You want to go ahead and note the texture, hair, for any balding, any infestations. You want to go ahead and palpate for any tenderness, noting any masses, any deformities, any tenderness. In children, it's especially important to be palpating for the fontanelles. After that, we would move on to the eyes. We'd go ahead and look at the eyebrows and the eyelashes, noting the hair, the texture, the symmetry. We'd be looking at the conjunctiva, the sclera, the lacriminal glands, noting any discharge, any redness, any obvious lesions. We'd go ahead and palpate the lower lid and the upper lid, noting any masses, any tenderness. We would go ahead and look at when using the otoscope, looking at the internal eye structures, looking at the macula and the fovea, at the arteries and the veins for any narrowing. We'd also want to go ahead and look for the red light reflex. I want to make sure if I'm looking at the left eye, I'm going to be using my left hand. So I'll be looking for the red light reflex. We're going to look at the optic disc, looking at the cup size, and looking at the color, which is normally around an orange colored. We'd also go ahead and do cranial nerve 2, which would be the Snellen eye chart. So the patient would stand 20 feet away and tell me if he could read the lowest line. I would also have a smaller card to check his nearsight vision and have him read that as well. So I go ahead and have him cover his eye, and we go ahead and look at the pupils, cover your other eye, looking at the perla, pupil equal and reactive to light. I would then go ahead and have him follow the pen light. So follow light, noting any lateralization or any deviation. And have you cover your left eye, and I'll cover mine, and I'm gonna we do the static finger test. So I need you to tell me when you can see it and how many fingers.
2, 1, 3.
And we do the other eye.
2, 3, 1.
And then I'll be testing for cranial nerves 3, 4, and 6. We would go ahead and go on to the ears. We would want to inspect for any obvious drainage, any lesions. You want to palpate the pinna and the tragus for any tenderness, any swelling, for signs of external otis externa or swimmer's ear. We then go ahead and look inside the ear. For adults, you pull up and back, and for kids, you pull down and back. You'd want to go ahead and look at the inside. You want to look at the, making sure you're looking at the tympanic membrane, noting any bulges, any air, any redness, any ruptures, looking at the malleus, looking at the cerumen, at the color and quantity, and you do this in both ears. You go ahead and check for hearing with the Weber test, which is cranial nerve 8. So let me know when you no longer hear it. And you'd be looking for lateralization at both ears. And you would note that air conduction is longer than bone conduction, which is normal when you do this bilaterally. From here, you would go ahead and you would palpate and inspect the sinuses, noting any tenderness. You go ahead and percuss the sinuses, and you could use your pen light to transluminate. We would then go on to the nose, noting any deformities, any drainage, any redness, any lesions. We would go ahead and look in the inside of his nose, looking at the nasal turbines, making sure that they're pink, moist, noting any septal deviations. We would then go on to the lips, noting the color, making sure that they're pink, not blue, looking for any signs of a disease process, any lesions. We'd go ahead and tell him to open his mouth. We would look at the posterior thorax, posterior pharynx, looking at the tonsils and grading them on a scale from 0 to 4, looking at his teeth, looking at the coloration, making sure he's not missing any, looking at the gums to make sure they're not bleeding. You could also palpate the inside of his gums and of his tongue for any tenderness, looking underneath his tongue at the submucosa. Go ahead and say ah, stick out your tongue. So that would be cranial nerves 9 and 10. Can you move your tongue from side to side? And that would be cranial nerve 12. We could also go ahead and test cranial nerve 5. So tell me if it is sharp or soft.
Soft. Sharp. Soft. Sharp. Soft.
And you could also do this on his arms too, bilateral extremities and lower extremities, and comparing the sensation in both of those. We could also test cranial nerve 7. So go ahead and smile. Frown, stick out your tongue. Good. And then cranial nerve 1, which would be sense of smell. I would go ahead and have like an alcohol swab. He would close his eyes. He would occlude one nostril smell, occlude the other nostril smell, and he would have to identify that scent, and that's cranial nerve 1. So moving on from the head, we'd go ahead and move on to the neck. Since he has a beard, it's kind of hard to visualize, but you would want to be looking at the at his trachea, making sure that it's midline, no deviations, no obvious skin lesions, no bulging, no masses. You would go ahead and palpate, noting any tenderness. You would go ahead and do your lymph nodes. So you have your occipital, postauricular, preauricular, submandibular, tonsillar, your post-cervical chain, and then your inferior cervical chain, as well as your subclavicle lymph nodes. You'd want to note any hardness, if it's firm, noting the size and the symmetry on both sides. And also go behind him and have him swallow and feel for the thyroid gland. From here, we'd go ahead and go on to the back. So I'd have him take off his shirt. I want to look at his back, notice any signs or symptoms of respiratory distress, noting equal expansion on both sides as he's breathing, counting his respiration rate, looking at the skin and the spine, seeing if it's symmetrical, also looking at his hips, at the iliacs. You go ahead and palpate, noting any tenderness, any deviations, noting any tenderness up on the spine, any bulging. I would go ahead and percuss, comparing it from side to side, noting tympany, making sure there's no dullness or hyperresonance, having him take a deep breath. We have equal expansion. You go underneath the 10th rib. I would do 99. Say 99.
99.
99.
99.
99. Which is tactile fermentus, noting any differences on either side. I would then go ahead and listen to breath sounds, listening for if they're diminished, if I hear any crackles, any wheezing, and you listen with both the bell and the diaphragm, and you're going to compare from side to side. Take a deep breath. Take a deep breath. Deep breath. Deep breath. And like I said, you compare sides from side, and you do it with the bell and with the diaphragm. While I'm back here, you could also go ahead and palpate the kidneys for noting any tenderness or any swelling. From here, we're going to go ahead and move on to the anterior chest. So again, the patient would have their shirt off. You would want to look at the expansion of his chest, at the thorax, noting any deformities in the rib cage, looking for pulsations, and go ahead and palpate, noting any pulsations or any, and feeling for the PMI. After this, you would go ahead and listen. You do it again with the bell and with the diaphragm of the stethoscope. So you have aortic, pulmonic, Erb's point, mitral, and tricuspid. And then your PMI, which is right below the nipple. And again, you'd be listening for S1, S2, noting any S3 or S4. And you could also have the patient lean forward to help listen for murmurs. If it's a child, you could have them squat and bear down, which would also help you identify any murmurs. You would do the cardiac assessment both laying down and also laying on their side. From this, you could also go ahead and feel for your pulses. So you start with your temporal pulses. You would want to palpate and listen with the bell, listening for any bruits. So you'd want to do the carotids, but you do it from one side to the next. Your brachial, your radial, and you have your ulnar. You have your femoral, which you can do as the patient lies down. Popliteal behind the knee, posterior tibial, and then on the bottom of the foot is your pedal pulse. You could also go ahead and check cranial nerve 11. So can you shrug your shoulders, turn your head from side to side, front, back. Can you push against me? Push against me. Shrug your shoulders. Good. You could also go ahead and feel for your joints, noting any crepitus. Looking at the hands, looking at the nails. You want to look at the shape, the contour, the groove of the nail bed. Go ahead and do your capillary refill, making sure that it's less than 3, and you want to check it on both sides of the hands and also the feet. You'd want to notice any skin lesions, like I said, any crepitus in the joints, any bruising, any swelling, any varicose veins in their feet, any pain or tenderness behind their calf. Go ahead and lay back. I'm sorry, sit back up. And men and women, you want to do a breast exam as well. So you'd have the patient put their hands behind their back. You'd notice any dimpling, the asymmetry in their breast, any nipple discharge, and put your hands up behind your head. Good. Now you can lay back. Okay. You then go ahead and palpate the breast. You would want to note any bulging, any masses, any tenderness. You want to make sure you come up into the tail expense, and then you could also do your axillary lymph nodes. From here, like I said, you want to listen again to cardiac and have the patient go to their side and listen to the cardiac as well. For the abdominal assessment, you want to go ahead and inspect for any bulging, any masses, any signs of hernias, any pulsations, or peristalsis movements. You'd want to listen first. So you want to listen for the diaphragm. You want to listen for bowel movement, bowel sounds, making sure that they are active and not hypoactive or hyperactive. You go ahead and listen with the bell at the aorta, listening for any bruits. You can listen at your iliacs, your kidneys, and then you can go ahead and feel at that inguinal and femoral pulse. You would then go ahead and percuss, noting tympany, and you would hear dullness around the liver and up at the spleen. You would go ahead and palpate, so you would do light palpation, which would just note the aorta, feeling for any masses or any bulging. You'd go ahead and try and feel for the liver in the right upper quadrant. So you would go ahead and if If you couldn't feel for it, you can go behind the patient's back and kind of press down. You can also do the scratch test, which might help you identify the liver border, and it should be, you would measure the span, and it should be between 6 centimeters and 12 centimeters. You could also go ahead and palpate for the spleen in the left upper quadrant. You'd also want to go ahead and check the Babinski reflex, noting any abnormal pulsations. Okay, from the abdomen, go ahead and sit back up. You would want to go ahead and do, in both males and females, you want to do your genitourinary exam. So for the males, you'd want to go ahead and inspect the penis and the scrotum and the testicles, noting any lesions, any redness, any abnormalities, any drainage. You'd want to go ahead and palpate the testes, noting for any hernias or any abnormalities there. In the women, you do the same thing. You'd have the patient lay on their back, you'd have their feet in stirrups, and you'd go ahead and look at the vulva, looking for any discharge, any lesions, any redness, and then you would have to use your speculum to look inside of the cervix and do your pap smear. So like I said, you would want to go ahead and compare the skin on both sides. You could go ahead and do your reflexes. So you have your bicep, you have the tricep, brachioradialis, patellar, and your Achilles. And then you'd have the Babinski, which is on the bottom of the foot. And if the toes stand out, that would be a positive, which would not be a good sign. You would palpate, which we already did, the pulses. You'd also want to listen for any bruise. You could go ahead and do your muscle strength. So grasp my fingers, push up, pull. Same with your feet, push, pull. Go ahead and rotate your wrist. Flex your wrist, flex your elbows, in, out. You do it on both sides. Do it with your knees, kick your foot in, out. When he was laying back, you can go ahead and do for the hips, so you just cross your feet. Go ahead and can you take your left heel and run it down your right leg? You can do it with your other foot. Okay, good. And cranial nerves. We can go ahead and just go ahead and stand, have the patient walk, noticing his gait, have the patient walk from heel to toe, patient hop. Okay, then stand in front of me, close your eyes, put your arms out, noticing balance for the Romberg test. Put your arms out in front of you, put your palms up, noting any pronator drift. Can you march in place? Good. Can you put your hands on your hips? Can you bend forward? Can you go to the side? Other side? You bend back? Good. Okay. Go ahead and sit back down. We would go ahead and do that for sterignosis and graphisia test. So go ahead and close your eyes and tell me what number I drew on your hand.
2.
Okay. And you do this in the other hand as well.
3.
And then you would place an object and have them identify it.
Paperclip.
Okay. You do it on the other side too.
Paperclip.
So we already did the neuro exam. We would, like I said, note his grooming, his mood, how he's dressed, and we could note his physical development just by looking at him. And I think that concludes our assessment. Thank you.